Hello, everyone. I am Dr. Stephen Boateng. I am the Director of Research at Sickle Cell 101. I'm also the founder of No One Behind Foundation, which primarily provides educational resources and services to individuals primarily in West Africa. So for today, my talk and discussion today is going to be covering sickle cell, COVID-19, and the vaccines. It's a lot for us to dive into. I really have some exciting data to share. So with that being said, I'm just going to dive in and talk more about what we're going to be touching on today. So I like to talk about these as a discussion versus a presentation or a PowerPoint slide. And so, I'll give you a quick review of COVID-19. I'm sure we all know what that is, but spend a little bit of time talking about its impact on sickle cell disease. Also talk a little bit briefly about some of the currently approved vaccines for COVID-19. And again, our emphasis for today will be kind of highlighting some of the key information around the African continent. So I'll be talking about the COVAX program and vaccine access in Africa. And then I'll review some really interesting and compelling data we've come up and put together at Sickle Cell 101 and our research team on one of our most recent studies we did run. And then I'll end with some recommendations from my end, and hopefully there'll be some questions that we can all dive into and learn together. All right. So with that being said, a quick overview here, right? So what is COVID-19? And so it's a quick refresher. I'm sure we've all heard about this pandemic. We're probably all tired of hearing about it now, but it's important that we keep learning about it so we can all work together and put this behind us. And so, COVID-19, you might also hear it being referred to as SARS-CoV-2. It is caused by coronavirus, and coronavirus is actually nothing new. It is a respiratory virus that has been around for a while now. But, with this specific one referred to as COVID-19, it's a different variant, and it particularly affects the lungs and airways. And once people get infected, the symptoms and complications can be severe. And of course, as we all know, even deadly, as we've seen even in India recently. And so you might be wondering, right? We all know about COVID-19 from a general population, but how does COVID-19 impact sickle cell disease? And so I'm sure, like we all know, I do not have sickle cell disease, but I have a sister who has sickle cell, and I know a lot of people who have sickle cell disease. And every person you talk to who has sickle cell disease will tell you that it is a multi-organ target disease, and it can affect any organ in the body. And so one of the things that makes COVID-19 and sickle cell disease unique is the fact that both are infections that are multi-organ target, right? And so, think about all the different organs. But I think most importantly, when we focus more on the respiratory sides of organs, that is what makes even COVID-19 more severe, particularly for individuals who have sickle cell disease. So again, let's kind of take a closer look and dive into where are we now in terms of research for COVID-19 and sickle cell disease. I think one thing that is fascinating, and unfortunately as expected, is that the research is behind and lacking. And it's because, this pandemic, I think priorities shift based on the individuals that are affected. But, there's been a couple of surveys and studies that have been ongoing around the world to evaluate sickle cell disease and COVID-19. But in terms of quantifiable data, there isn't much out there. I think one thing that is agreeable across all different, enforcement agencies and government bodies and researchers and scientists is the fact that sickle cell patients are in the clinically extremely vulnerable category with COVID-19 infection. And because they wanted to make sure that individuals with sickle cell disease do understand that if they do get affected by COVID-19, the symptoms can be severe. The second statement I have here says individuals living with sickle cell disease are at an increased risk of severe illness from COVID-19 infection. This one is from the CDC here in the US. And it was really to emphasize the fact that, when this pandemic did hit, it was kind of trying to identify which populations are at a higher risk. And sickle cell, individuals with sickle cell is actually among those populations, again, like we talked about, because of the way the disease affects individuals and the multi-organ target nature of this COVID-19, also sickle cell disease. So again, to reemphasize, sickle cell disease is very severe disease, but even for people that have sickle cell disease and do catch COVID-19, it can even get worse for them. To even summarize that, again, like I talk about, the data isn't really a lot out there, but there was a recent study, and the study it was a study that did find that people with sickle cell disease who had developed COVID, they did have higher rates of hospitalization, intensive care unit admission, and even death. Again, unfortunately, so there's people that did die in this study. This was actually a study that was conducted here in the US, and it looked at about 178 patients. And so it did actually further emphasize that risk that both governing bodies had put out to make sure individuals with sickle cell disease were well taken care of and were taking very, very proper precautions because of the severity of infections that can occur if they did contract COVID-19. Again, this was one of the few studies that had come out even to date that did highlight sickle cell disease and even COVID-19 in a little bit more detail. So that is really what we have so far in terms of COVID-19. For me as a researcher, one of the things I always try to teach, whether it's students, colleagues, or even friends or advocates in the sickle cell space is that, we cannot always wait and sit and wait for catch up. Unfortunately, it might take some time before we really do have quantifiable data to really understand how COVID-19 impacts sickle cell disease patients, but we need to learn from each other and understand how is it even affecting people now, whether it's individual, whether it's case reports that can help us understand how we can care for those that do have sickle cell disease or how we can advise them. And so I want to spend a little time, just give you a quick overview about the current vaccines that are approved, right? So these are, based on the country you're located, here in the US, I'll tell you guys, I actually just got my last shot this past weekend. And I did get the Moderna vaccine, but I think the good news is that these vaccines are becoming more and more available across the globe. And so this just gives a high level of all the different vaccines. One thing you would notice is that some of them are actually still in clinical trials. And when I say that, what I mean is that even some vaccines that have been approved are constantly being studied to see if they might even be beneficial for different age groups, as we're starting to see the Pfizer vaccine being evaluated in even much more younger populations. So again, the vaccines are available, but there's some challenges. Like I said, here in the US, vaccines are free. And I think most developed countries, the vaccines are free. But if we start diving closer into our African continent, and now keep our individual level sickle cell disease in the back of your mind as I go through the part of this discussion, right? In Africa, it's a big challenge, and so one of the programs that has really helped make vaccines accessible to these under-resourced communities I grew up in Ghana. So in Ghana and all other African countries is the COVAX program. And what COVAX stands for is COVID-19 Vaccines Global Access. And what this program really is it's really based off of a collective group of entities, right? CPI, Gavi, UNICEF, and World Health Organizations. And their goal is really support research and development, making sure these vaccines are available to these communities. They also help make sure that for the communities that do have to pay for the vaccines, they can negotiate that at a reasonable price. And also one of their biggest goals is making sure that they provide over 2 billion doses worldwide by the end of 2021. One of the statements that, the COVAX program did put out in the early phases when this program started was no one is safe until everyone is safe. And it is a big deal. And so for me, again, that's why I was talking about the fact that we have to keep our friends and families that do have sickle cell in the back of our minds. We need to pay attention and figure out how we can also give them access to vaccines, even if they live in under-resourced communities, even if they live in communities that unfortunately they might have to pay for it or they might have to face some barriers, because I also need to have access to the vaccine and make informed decisions in terms of whether they should or shouldn't get it. And so, the COVAX program is what's really helping most of these African countries gain access to these vaccines. And it started actually in February of this year. And, Ghana was the first country that did get this program and started the vaccination. But there has been some challenges with it. I do have some of these pictures to kind of highlight. It was like all over the news early in February about all these countries. As you can see here, President of Ghana, the second, the vice president's wife here in Ghana, and even in other countries in Nigeria, and also other North African countries started getting these vaccines. So again, to emphasize, the COVAX program did help make these vaccines available for us. But it is important to say that there has been some challenges that has come with this program. So my question is, where is the sickle cell community at with COVID-19 vaccine so far, right? I talk about COVAX being helping make these vaccines available in Africa. There's some challenges over there. And even here in the US and even other countries that do have access freely, there's also some challenges there. So I just highlighted some of those two statements I talked about earlier so we can remember that. It is important that we keep in mind that for individuals that do have sickle cell disease, they are at one of the highest risk populations in terms of getting severe infection from COVID-19. And they still have challenges with it. And so we at Sickle Cell 101, one of the things that we did was we didn't want to sit and wait. We really wanted to understand the community's experiences so far. Are people getting the vaccines? What are their thoughts about it so far? What are the symptoms they're getting? Because one thing that we know is we all learn best when we learn from each other. So while we wait for more research to come out, we started this survey, and this survey is a global survey on COVID-19 vaccines access, uptake, and perceptions in the sickle cell community. And all we try to do is just survey our global community to really understand this uptake of these vaccines and even understand what, for those that have sickle cell disease that have already gotten the vaccines, what the experiences were. And what we always try to do is share back that information to help other people understand what's going on. Maybe it might be a reason why they feel more comfortable getting it, or it might be a reason why they ask follow-up questions. Our job is to make that information available so people can make informed decisions. And so to take a quick look at the data we've gathered so far. So in terms of demographics, with this study, this was really an open study, very interactive on our social media platforms. And actually, there was even a giveaway associated with this. And so one thing you will see the demographics here is that we had over 55% of population that did report having sickle cell disease, and most of them were hemoglobin type SS in this survey. There were also additional individuals involved in this survey. Some did have sickle cell trait. Some people didn't even know they had sickle cell disease or sickle cell trait status. But most importantly, majority of the participants in this survey did have sickle cell disease. 25% did also report that there was some form of caregiver or parent or a spouse or person living with sickle cell disease, and 15% responded that they're diagnosed with sickle cell disease and they also are caregivers of individuals that live with sickle cell disease. So let's dive even a little bit closer into the demographics. The ethnicity proportions of this study did show that, 53.8% were Black, and, that was a majority of the population. And then it was really evenly spread across all the different ethnicities, right? So there was a lot of diversity in this study. But again, majority of it were Black or African-American, which like we all know, I always like to emphasize that sickle cell is not a Black disease, but it does disproportionately affect individuals of Black or African descent. So this study did represent that true population. 66% were female, 31% were male, and 3% didn't show the identity, which was totally fine. So let's dive into some of the data we asked and the questions we asked so far, right? And so of the individuals that were surveyed, 8% that did identify as having sickle cell disease also mentioned that they had already caught COVID-19. And so for those people, those people that responded that they had already caught COVID-19, 18% did say that the symptoms that they did have were very severe. And then 29% of that population did report that they were very worried about those symptoms that they did get. I think one thing that was important here is this box you all see in the middle here, right? 48% of the individuals living with sickle cell disease who had not caught COVID-19 yet believe that they were somewhat or very likely to catch COVID-19. Again, emphasizing that the risk is there, and these individuals that have sickle cell disease, they do know and they do acknowledge that. And I think one of the things that was very telling is for us to really understand what is the community's thoughts and impressions about COVID-19. So we asked the community, if you were offered a vaccine, what would you do? And I think what was impressive was 57.9% of the population said, yes, they've been offered a vaccine and they already got a COVID-19 vaccine, which is positive. And I think one thing that we keep hearing about, most of these are speculative, is that, people don't want to get a vaccine, or people with sickle cell disease have concerns about it, which is true. But there's also some truth on the other side too, which does state that there are other people who do have sickle cell disease that actually do want to get the vaccine. I think another number that was fascinating for me here is that we had over I think it was about 22% right here of individuals that said they hadn't been offered a vaccine, but they would like to get a vaccine. So again, there's a gap there. And what that is telling us is that we can do better to help these people get access. So for those that do want to get vaccines, I think it's good that we help provide that access to them. And again, for those that had already received the vaccines, we also wanted to understand some of the symptoms that they had experienced from those. And majority of them did mention tiredness as being their major symptoms, among many others you can see as muscle pain, headache, fever, pain, chills, you name it. But tiredness was the one that was most reported. Now, even expanding even further into the data here, we try to ask the community, right? What was your reason why you got a vaccine? For those that decided they got a vaccine. And we also asked for those that decided not to get a vaccine, what was the reason why they decided to not get a vaccine? And that is what you see on this table here. I think what is very telling here is we had about 53% of the population saying that, they decided to get a vaccine because they wanted to protect themselves, their families, and friends. And keep in mind, most of these individuals are people living with sickle cell disease. And for those that decided not to get a vaccine, one of the things that was telling here, we have about 29% saying they decided not to get a vaccine because they were uncertain about side effects, right? And so there's a knowledge gap there. We're not doing a good job, whether we being healthcare providers or nonprofit organizations or religious bodies, of really educating the community. Trust was another big one. 24% said they do not trust it. So, I could go on and on here, but I think that there's a lot more work in terms of education that needs to be done to help build more confidence with vaccines for our community. We did ask the community, right, in terms of the vaccine safety and efficacy. And what are your thoughts on it, right? So is that overall, how much do you trust that a coronavirus vaccine will be safe? We had about 38% that said will be safe, but there were some hesitancies here. I keep highlighting these because this does tell us the gaps that we're seeing in our community and the work that we need to do. I think one thing that was assuring is that 77% of patients that, were sickle cell patients did believe that the vaccines were somewhat or very effective at catching it. So people started to understand what these vaccines are and the potential the vaccines can make. I think one of the things that was very telling with our study here is we always want to understand our sickle cell communities trust within the medical and research community, because as we all know, there's been this long-standing mistrust between the sickle cell community and the medical community, understandably so. So we always want to know, where is that pulse at? Are we doing a better job? What else can we do to improve? And so again, the data here, I think we're making progress. 43% said mostly they do trust the medical and research community. But, there's people on the left side here, 27% says somewhat. And as you keep going down and down, there's certain individuals that report that, they didn't trust the medical community. And so again, I think it's improving, but it does also show that there's some more work that we need to do, especially from those of us that are healthcare providers, to make sure that we educate our community properly, help them understand what we're trying to give to them, whether it's a vaccine or anything else, so we can help build this trust and improve all of that. Taking even a step further, right? So vaccine perception. So we try to ask the community. I think one of the biggest questions we were trying to dive in here was that trying to understand the general sickle cell community's perceptions about, do you think that people with sickle cell disease should get a vaccine? I think the recommendation is yes, based on the things that we've seen from the severity of COVID on sickle cell patients. But we also wanted to understand, what does our bigger community think? And I think what's assuring is over 66% of respondents do think that people living with sickle cell disease should get a vaccine. We still have, over 30% that are saying otherwise. But I think it's assuring to know that people do acknowledge that individuals who are living with sickle cell disease should get a vaccine. For me, this was assuring for me to see, but I always like to tell people that this is a general population's opinion and comment on it. But I think at the end of the day, this does tell us that we are making progress, and people do believe that sickle cell disease poses a risk for people that do catch it and that do catch COVID-19. But again, I think, based on individual situations, that might mean maybe they should or shouldn't get a vaccine, and that question might still be left to answer. But I think this was very telling, very assuring for all of us. One of the things that I think was most important about this whole study was participants' knowledge on vaccines. I always like to take a step back and really understand, there's a lot of buzz about COVID now, and everybody's worried, and understandably so. We're all in quarantine, and we're all being made to stay at home, and there's so many uncertainties happening. And vaccines have been around forever, but how much have we done as a medical community, as a research community, as a government organization to make sure people understand all these different vaccines and how they work? And I think what was interesting is that we asked the community, how much do you feel you know about each of the following? When we asked them about how much do you know about how vaccines are created and tested, majority of them said just some. They don't know much about it. And so again, we haven't done a good job educating our community about how vaccines even work in general. And so it is fair to see people posing back challenges or people having concerns about these vaccines when they come out and we're telling them to get it. So for me, it's good for us to take a step back and understand that we need to take a step back and really help our community understand vaccines, right? And know that, why are we recommending pneumococcal vaccines for people with sickle cell disease? And we haven't done a good job at it in the past. And so when COVID-19 vaccines are presented, I think the community has a right to say, hey, wait a minute here. I don't know what's going on here. This last part says, how much how much do you feel about each of the following? The last part says what COVID-19 is. A big majority said they do know a good amount about COVID-19. When it comes to vaccines, just some. So again, speaking to how much work we need to do. And I think this data here, as I come to the end here, is also very telling. When people are deciding to get vaccinated, these are some of the things that they are saying is affecting their decisions in terms of getting vaccinated, right? So people are saying that, they'll get vaccinated if they have confidence in the COVID-19 vaccine safety and efficacy. So if we do a better job at that, that will build more trust and help people feel confident getting vaccinated. And people's decisions are also affected by the advice from the people they trust, whether it's a family member, a caregiver, the doctor. And even here, they talk about the advice, the recommendations they get from the doctors too. But I think what's also important is that the advice that people receive from people who've already received the COVID-19 vaccine, again, that's why we really did this study, right? Help people learn about, for those that already got a vaccine that have sickle cell disease, what are the experiences? That helps other people feel confident or really understand what to expect. And I think those are some of the big factors that affected people's decisions in getting vaccinated. And it's important that we highlight those so that our community gets a total education around vaccinations. And I think that is what our goal should always be. Again, I talked a lot about us. We need to take a step back and do a better job educating our community about vaccines in general, right? So we asked a question in there, what participants' adoption in terms of their yearly vaccines? How often are people getting their yearly flu vaccines, and why do we recommend that for sickle cell patients? Over 56% of participants said they get it every year. But what I'm really looking at is, if you look at the remainder of the population, some get it every few years. Some say never. 14% say we haven't done a good job with vaccines in general, not just COVID. And so I think we need to take a step back and really evaluate how we educate our community about vaccines, how they work, why they're being recommended for sickle cell patients, and what they need to watch out for. I think all of this data I've shared so far is very telling and really gives us a pause and tells us a lot about what we can do more for our community. So in conclusion, like this conference has our theme, right? What next? What can we do to improve care for sickle cell in general? And so with emphasis around COVID-19 and the data we've gathered so far, my recommendation specifically for healthcare providers here is that we really need to take a step back and help answer the questions that these patients have presented, rightfully so. A big advocate for is education with empathy. Most of the time we like to shove information down patients and caregivers through. Go get a vaccine. It's safe. It's been tested. It's a difference between saying that versus saying, hey, as far as the vaccines that we have so far, the benefits do outweigh the risk. We do not have all the answers yet, but we do recommend that you get it. Please talk to your healthcare provider and see if it's right for you and go get it. The way we educate can go a long way to build trust between our community. And so I encourage all our healthcare providers on this platform to make sure that they are using that empathy in their educational measures and adding in their toolbox to make sure that they talk the right information to patients. This second bullet here is 1 is better than 0 to save for 2 later. You're probably wondering why all these numbers. What this means is, I just pulled this data, I want to say a day or two ago. And what was interesting is that the current state of that COVAX program I talked about, almost every African country has received vaccines. But one thing that we're seeing is that some countries are actually saving vaccines for later because they're worried they're going to run out. And so my recommendation to healthcare providers is please, especially for those of us on the African continent that can really help our sickle cell patients, please make sure that you're not just saving vaccines because you're worried somebody's going to need their second dose later. If all you have is all you have, please make sure you're giving these to the patients because some immunity is better than no immunity. And so, the data did show, and this was from the WHO and the Gavi program, did show that some countries are saving vaccines for later. And so people will go in and they're not giving it to them. And so I encourage healthcare providers to remember to give these vaccines to these patients, especially for those that are most vulnerable, which includes our sickle cell population. So what's my recommendation for those in government organizations and policymakers? My biggest recommendation is please prioritize access to vaccines for sickle cell patients. I think I've expanded on that enough. I think, like we all know, our sickle cell community and those living with sickle cell disease, they are one of those with the highest risk of severe infections from COVID-19. So our government and policymakers need to make sure that when vaccines are made available, whether it's the COVAX program or other programs or other countries are donating to most of our African countries, please prioritize access to our sickle cell patients. I also encourage our government and policymakers to ensure transparency with access, distribution, safety, and efficacy communication. So I think that's what really helps build trust within this community. And I think this is where the bulk of the work needs to happen because we do know that the challenges there, right? They're the key questions patients are asking. Is this going to change my DNA? Why were the vaccines made so fast? What side effects am I supposed to expect? All of these questions need to be answered. And we need to make sure that our government leaders, and along with working with healthcare providers and policymakers, are working effectively to communicate transparently to our patient community, and most importantly, prioritizing those who live with sickle cell disease. So as I bring to an end, my takeaways for the sickle cell patients here, right? You guys are the most important groups among all of us here, and you are the reason why we're here today. I always say, please prioritize your sickle cell complication management, whether it's a VOC, vaso-occlusive crisis, or an acute chest syndrome, whatever complication you might be facing, prioritize that. If you have that and that's a reason why you can't get a COVID-19 vaccine, you want to feel better, I think it's okay to do that as long as you're in good communication with your doctor. One of the things I also like to tell our sickle cell patients is that please make sure you evaluate your past experiences with other vaccines. If you've gotten vaccines in the past and you had really bad experience, you need to sit down with your doctor and really talk and understand what those experiences were. Were they anaphylaxis or were they near side effects that can be well managed? Maybe understanding that can really help you build confidence and help you decide if a COVID vaccine is right for you or not. I think it's also important that you confirm the ingredients in whatever vaccine you get and have some prophylactic support next to you, whether it's Benadryl, Tylenol, ibuprofen. I'll tell you, for me, this vaccine, the second dose knocked me down pretty good, this past Sunday and Monday, but I recovered because, I did take some ibuprofen and some prophylactic treatment. So please make sure you have those on board. And if you have to get a second dose, please make sure you're getting that and continue with your, wearing masks, social distance, and following guidelines. I know some countries are now, relaxing those rules a little bit. Just make sure wherever you are following appropriate guidelines because at the end of the day, unfortunately, having sickle cell disease means you are one of those with a higher risk of infection from this disease. And always reach out and stay informed. We all don't know it all. So please continue to ask the questions you ask. You individuals with sickle cell disease, you are the most important. And we owe it all to you to make sure we answer all your questions. And so my final recommendation for everybody on this platform today is that working together to overcome sickle cell disease involves addressing all other factors like COVID-19, which significantly impacts this community at a disproportionate rate. So we can talk about all the different complications, all the different challenges, but we need to also remember there's a pandemic going on and COVID-19 is also putting a toll on our sickle cell community. We need to address that. We don't know all the answers. And so when we communicate, we need to remind individuals that it's all about risk and versus benefit, and we keep learning all of this. And my last thought for everybody is remember, your experience is your expertise. Use it. Your past experience with vaccines, your past experience with going to the hospital, all those different things are the totality of your health. And so if you have a reason to say maybe you want to wait until you get a vaccine later, make sure you communicate with your doctor and don't feel shy for talking about it because everybody's experience is different. And with that being said, I hope this helps. Please let's continue to advocate for our sickle cell community, and hopefully, especially on the African continent, we can help make these vaccines available to this community, which deservingly so need it. Thank you, everyone.